let's bring in our good friend, Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. And, Joe, you're going to go to the head area concussion protocol.
Yeah, Ray, specifically with the today what I wanted to review a little bit is how are we doing with the dreaded targeting rule. It just seems like it's very unpopular with so many fans. I would venture to say probably 75 or 80% of fans hate to hear the word the targeting rule. They talk on the TV about how controversial and how, you know, it's so difficult and people really dislike the rule. But, you know, the sports medicine people were behind the officials. The officials take a lot of the flack for it. But as we were kind of tasked with trying to save the game of football and other sports that have concussions, we thought the thing about the targeting rule that we were going after with the rules committees were trying to change behavior. Somewhere along the line in the sport of football, people kind of, and this is way back, 70s and 80s, began to think that they could really deliver the hardest blow they could by lowering the helmet in the head and hitting people that way. And really that's when we started to see the significant increases in concussions into the 90s and 2000s. And the 2008 was the first that we had a targeting rule at all. It was brand new, and it's a little hard to evaluate as I try to go through the studies in the last couple of days, because really we're looking at three levels. And so, you know, the youth level, the high school, then we look at college, and then we look at the professional level. So it's a little hard to say. And the other thing that's happened in the decade of 2008 to 2018 is the rule really evolved, and I think it improved greatly. And early on, you know that I was a little bit critical that I didn't think it was changing behavior, so I didn't think it was changing the numbers that much. But I really do believe that more recently with some of the updates of the rule, such as the penalty, you know, just having a penalty for it, or later on in the NFL a suspension after the fact was never very helpful. But the issue of removal of a player, taking them out of the game, that really, I think, has made a bit of a difference. I think also as they refined the rule is using the crown of the helmet. Now everybody's talking about that term, crown of the helmet. That's where you lower the head, and it can be an offensive player, a defensive player. And the other thing that people still don't really understand, you don't have to hit the person in the helmet, in the head anymore to get targeting. If you lower the helmet and deliver a blow to somebody, you'll get called for it, and you will get suspended or thrown out of a game. We've seen it in national championship games in the last 2 years, and one of them was not delivered directly to the helmet. So there's still a lot of people don't understand the rule, but I do believe it's working. I am encouraged by it. I've told you before, the first rule that I was encouraged by was the kickoff rule, with the ball going in the end zone and eliminating a lot of kickoffs. This maybe is even doing a better job. So in the NFL, for the third straight year, there's been a fairly significant drop in concussions. And the NFL has a better handle on looking at these things, so I think they can get an accurate report. This past year was the lowest in the past 5 years, and they think 2021 is going to be lower again, so it'll be 6 years. College is a little more unclear. I looked at a lot of studies last night. The biggest thing in college that they looked at with the research is that a lot of the concussions still occur in practice, and there's really no reason for that. People can come up with ways to change practice so that we're not getting a lot of the concussions in practice. So we have to make sure to make that change. You know, down at our office, and I know you know this, the majority, many of our concussions, the most of them really are in other sports. Like there's increases continuing to go on in girls soccer, volleyball, soccer on both sides, hockey, wrestling, rugby, all our other sports that we see concussion. But I do have a lot more hope for the targeting rule that it is changing behavior a little bit. I don't think players want to be removed from a game, and I think they're thinking twice about lowering the crown of the helmet on offense and defense. And I think we are getting some improvement, and I like the rule, even though most fans don't understand it fully and don't like it very well. I've got to say, from a sports medicine standpoint, I think it's been somewhat effective in the last 3 or 4 years.
Well, Joe, I like the rule too. I guess my only problem with it is it seems that it's mostly directed at the defensive side of the football, which I agree with, but you'll see a lot of times the offensive player using that crown of the helmet, especially in the running back situation or wide receivers in the open, lowering their head to get them additional yardage. And that is where I think the fans have the problem with the targeting rule. I don't think it's necessarily the safety aspect. I think we all want these kids and players to be safe. It's just the clarity of offense and defense.
I think you are exactly right. As usual, you're a very astute student of watching what goes on with this sport. I think that if everybody steps back and during the week and during the off season, everybody wants the game to be safer. But I think that people think that there is some inconsistencies in the way it's called. And I think even officials that came up at a different time, I don't think they look at it offensively as much either. And I really thought that there was going to be a difficulty with officials as we went on to important games like playoff games and other things. I think they're getting pretty good at calling crown of the helmet on defense. I think we could do better on offense. But overall, I think it's been a benefit and an improvement, and I'm all about that, and I'm encouraged by it. So I'd have to say overall, I'm very happy with the direction we're headed with this particular rule.
I am as well, Joe. I think so as well. Hey, Joe, let me ask you this, and I know you're really tied into this as far as concussions and everything. We're seeing more and more states. I was just reading last week that another state is jumping on with the tackle football being put back to 13 years of age. One even went to 15 years of age. What is research telling you about head injuries and concussions with the high school athletes and younger? Are we making progress there as well?
We don't have enough research yet to really say that. This is very important, and I was on a virtual call earlier this week about studying it here in Ohio, and we're looking at a study that might include the Catholic diocese, and if we got Cincinnati, Columbus, and Akron, Cleveland on board, we could look at a lot of people, and we could get some research to look at that. But this is kind of the gradual progression into football, with starting with perhaps flag, progressing to 7-man or 8-man football, and then going on as they get closer to high school to begin to learn the game. And I think that makes a lot of sense, too. But again, as I say all the time, and I know you know it, we have to research it. And I think, again, we're trying to push the state of Ohio. We're in the center of it all. There's a lot of really good sports medicine here, and I've talked to a few of my colleagues at other places in Ohio. We have to bite off. We can't bite off more than we can chew. I think Ohio would be a good place to look at youth sports because there's so many programs at all the children's hospitals. So right now we're looking at a project that would start within the next year, and we have some funding for that. We have some people that have jumped up, and that really helps, and said that they would fund a project where we could study youth football to see if that progressive involvement in football is safer. I believe it would be, Ray. I think it makes sense, and that's why I really want to study it and be able to say maybe on the radio 3 or 4 years from now, yes, that made a difference too.